Money, 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 money. Ah! Are money worries bombarding your thoughts? You are in the right place today. Welcome to Bring It to Bella, where the practical and emotional sides of money come together to ease your worries. My name is Bella Nissen, and this episode is devoted to health insurance. Specifically, what I want to share with you are some options for what you can do when you've lost employer-based health coverage. If you're going through this right now, it's probably because you're in the midst of dealing with a job loss. And I know this is a stressful time. You probably have a whole lot of worries about money on your mind right now. Things like how to replace your income, how to pay your current expenses, and the health insurance, just one more thing you have to deal with. I hope I can make this one thing simpler for you by helping you figure out what makes the most financial sense at this time. I'm going to share 5 options that are available. Some or all of these may be options for you personally. I'll share with you the pros and cons of each, and at the end, I'll give you some guidance to help you figure out what the best option is for you personally. Here's the 5 options. You've got COBRA, the health insurance marketplace, Medicare for those who are eligible, someone else's insurance, if that's an option, and finally, do nothing at this moment. I'm going to share some key details now about each of these 5 options. The first option you have when you've lost your employer-based health coverage is COBRA. You may already have been given the paperwork for COBRA, or you may have been told about it. The acronym COBRA stands for the Consolidated Omnibus Budget Reconciliation Act. There's a mouthful. Fortunately, you don't ever have to remember that. All you need to know is that this act means that any company that offers a group health plan to 20 or more employees has to offer to continue that health coverage for you. It may include medical, dental, vision, and a prescription plan, but it won't include life insurance or disability insurance. Here's the important things you'll want to know about COBRA. Your employer has 14 days to send you enrollment paperwork after the qualifying event. You have up to 60 days to sign up for COBRA after your prior coverage ends. Even if you don't sign up for COBRA on day 1, coverage starts the first day after your prior insurance ends. In terms of how long you can keep COBRA, it's 18 months in most cases, and in some special situations in certain states, New York, for example, it's 36 months. I'm now going to dive into the pros and cons of COBRA. Let's start with the pros. You get to keep the exact medical coverage you've been on. This can be a huge benefit if you or any of your dependents regularly see doctors, have any major health issues, or prefer to see particular doctors that you know are covered by your current health insurance plan. You don't have to make any changes or find new providers. Another benefit is that anything you've paid towards your deductible or out-of-pocket for the year is going to carry over. You can also continue your flexible spending account if you sign up for COBRA. I mentioned earlier that you have 60 days to sign up for COBRA, so you do have a little time to think about it. Remember, no matter when you sign up within those 60 days, your coverage will start the day after your prior coverage ended. So there's no gap in actual coverage. The initial premium payment has to be made within 45 days after the date you officially choose COBRA. So you also have a little time to make that first payment. One final benefit about COBRA is that each eligible person in your household can choose COBRA or not. For example, a spouse can elect COBRA and the employee may not, or vice versa. Now let's look at the cons. There's really one main downside. COBRA costs a lot. Many times, even though we say health insurance is a benefit, we don't sit around thinking about the actual cost of that benefit. For most people, they're sticker shock when they see the price of COBRA. The good thing is that there are other options that are less expensive. Before we go into those options, here's how you can find out more details about COBRA. You can either take a look at your COBRA paperwork, or you can check out the Department of Labor website at dol.gov and then type in COBRA in the search box. Several options will come up, and I've found the one called COBRA Continuation of Coverage has a lot of useful information. The second option you have available when you lose employer-based health coverage is finding a policy on the health insurance marketplace. When you lose job-based health insurance, you're eligible for a special enrollment period where you have 60 days from the loss of your job insurance to select the plan in the open marketplace. The website for this is healthcare.gov. The best way to see all your insurance options is by filling out an application. You can do that online, or you can get assistance through some organizations and brokers. You won't be committing to anything by filling out an application. It will just give you the opportunity to find out what insurance policies are available to you and how much they'll cost. Some of the information you'll need for yourself and anyone else in your household are names, dates of birth, social security numbers, income, and policy names and numbers for the health insurance you had. When you fill out an application, you'll also find out if you or anyone in your household is eligible for programs like Medicaid or CHIP. CHIP stands for the Children's Health Insurance Program. You'll also find out if you're eligible for a tax credit towards your premium based on your estimated income for the year. Something that you want to make sure of as you're comparing COBRA to the health insurance marketplace is that you're comparing apples to apples. Some plans on the marketplace will include dental or vision, so just make sure you're accounting for those options as you compare plans. Once you choose a plan in the marketplace, you can't change your plan until the next open enrollment period, or if you happen to qualify for a new special enrollment period. Now, here are the pros for finding a plan in the health insurance marketplace. There are often a lot of tiers of options available on the health insurance marketplace. For example, there may be a silver tier, a gold tier, and a platinum tier. They each would have different monthly premium costs and different benefits. With a wide range of choices, you can choose something that best fits the needs at this time for you and your family. For example, if you all don't have any major medical issues and you'd prefer paying a low monthly premium, that's an option. There are also plans that provide basic medical appointments for an inexpensive price, as long as you're flexible on which medical providers you see. For example, right now, let's say under your current insurance, you can go to any provider where you live. An option under the marketplace might be a health plan that covers one specific hospital and one healthcare entity. If you choose that, you'd have a smaller pool of providers to choose from, but your costs will likely be much less. Something that I want to point out is you can also do a combo of COBRA and the marketplace. You could do 1 month of COBRA and then switch to a marketplace plan. Now let's look at the cons to the marketplace. Any money you paid towards your annual deductible or out of pocket is not going to carry over. Another challenge is that you may have to switch providers, which can take time to set up. Also, you could face challenges in being seen if the providers you want aren't accepting new patients. Now let's talk about a third option. This is going to be available for some people, but not everyone. It's Medicare. If you or anyone on your health insurance plan is Medicare eligible, Medicare becomes the primary insurance for that person. If Medicare is an option, but you're not familiar with how it works, you can contact your local SHIP office to find out more information about Medicare plans. SHIP stands for State Health Insurance Assistance Program. Their website is shiphelp.org. You can find your local office there and contact them. They are made up of staff and volunteers who are very knowledgeable about Medicare and can help answer specific questions you might have. A fourth option is going on someone else's health insurance plan. This is again an option that's available for some people, but not everyone. Often, this is an option for married couples and individuals who are dependents. If you're married and your spouse has a job that offers health insurance, you can often go on your spouse's plan. Other people who might be eligible for this are age-eligible young people who can go on their parents' plan, or anyone who is legally a dependent on another person. What you'd want to do is check with the HR department and find out what the cost is and when you need to enroll by. Fifth and finally, is an option that may be seen as controversial, and it's this: do nothing. Have no health insurance. I can hear the gasps now. Why would I even suggest this? Here's why. You have 60 days to enroll in COBRA, and no matter when you enrolled during those 60 days, you're going to be charged for the premium starting on day one after your prior health insurance has ended, and you'll be covered from day one. You could take a chance, if you don't have any major health issues, as you're looking for a new position, to temporarily do nothing. You could just fill out the COBRA paperwork and have it ready to go if a medical issue comes up. Here's the pro to not signing up for a plan right away, and it's pretty obvious. There's no cost. Yay! Which can be very helpful when you've just lost your income. The con? You wouldn't have health insurance. If you do have a major medical situation come up, that can be financially devastating. Doing nothing, even temporarily, has some risks. What if, even if you have the paperwork filled out, you have a medical situation arise that is so severe, you can't get the paperwork submitted? You'd be without coverage. There are complications and risks with this last option, but I think it's important to know all of the options available to you. Now let's look at what is the right option for you personally. I want to give you some questions you can ask yourself to help figure out what your best option is. Just 2 questions. Here they are. First, what are the current medical needs for myself and anyone who's on my health insurance plan? Second, what can I realistically afford to pay, or what am I willing to pay for health insurance with having a change in my income? Here's an even more concise way of saying it. What can I afford, and what do I absolutely need? We hear all the time that health insurance is important, and it sure is. But money is also important. You need money to pay your mortgage or rent, and buy food, and pay for transportation costs. Those things don't go away with a job loss. What you'll want to do is figure out what the right balance is for you and your family during this time. It's easy to get overwhelmed with all the details of these insurance plans. Let me summarize some key points for each option to help you as you think about this. Option 1, COBRA. This is great for anyone who needs to see a doctor or a specialist on a regular basis. You get a smooth transition of coverage and providers, and you get to carry over money you've already paid towards deductibles and your out-of-pocket max. If you don't need to see medical providers regularly, COBRA is generally a very expensive option, and you may be better off making a different choice. One of those choices is the health insurance marketplace. This is a great option if you want the ability to choose a price point that works for you. The downside is that you can't carry over any deductible or out-of-pocket you've already paid. But if you're at the beginning of the calendar year or haven't paid much, that matters a lot less. With the marketplace, you can also see if you can find a plan that's comparable to what you currently have for perhaps less cost than your COBRA. Just remember that with this option, you may have to switch providers. So I suggest contacting providers and see about their availability before you purchase a specific plan on the marketplace. Options 3 and 4 are available for some people, not everyone. That's Medicare or going on another person's health insurance. If either of those apply to you, these can be great options because generally the cost will likely be much less than COBRA or the marketplace. Finally, option 5, the wait and see approach. Do nothing other than fill out that COBRA paperwork and see if you end up needing it. I have 2 final tips for you no matter what decision you're looking at. First, I would recommend that you don't go longer than 60 days without health insurance. The reason for that is if you go without health insurance for more than 60 days, you will probably fall out of being able to enroll in most insurance plans. And my second tip, don't wait until the last day to make a decision. I hope this information has been helpful for you as you figure out how to make a decision about health insurance. The main thing I want to tell you is keep it simple for yourself. Just focus on the big picture right now when it comes to health insurance. It's so easy to get wrapped up in the minutia of each option. But if you focus on those 2 questions I gave you earlier, that can help guide you and keep you from getting distracted. I wish you all the best during this time. both with making your decision about health coverage and with obtaining a new income. You have the information to analyze and make a good choice for yourself right now. Your decision is the one that's right for you. If you've got an issue around money that you'd like to hear me talk about on Bring It to Bella, send me an email, bellayoutube@bringittobella.com. Thanks for spending time with me today.